When we hear somebody is talking about migraine, it's not just a headache. It's a genetically neurological condition causing nausea, vomiting, vision changes, dizziness, light and sound sensitivity, and sometimes difficulty in speaking. Migraine is something beyond the headache which impacts the activities of daily living and affects the ability to do the things. It's quite common to know that migraine is due to the changes in the body and the brain chemistry, and even genetics accounts for about half of all the migraines. Migraine brings a range of symptoms which may vary from one person to the next. Before that, let's know and understand why this type of headache is called migraine. Migraine is derived from the Latin word hemicrania, that means half skull, and this word we can say it like migraine from the migration, as migraine has got the headache that keeps on changing its places. There are certain phases of migraine that we need to understand. So before the attack of headache, for 1 to 2 days prior, there is a state of sickness in the patient's body. That phase is known as prodrome phase. Following this prodromal phase, there is more of eye symptoms or blurring of vision, weakness in hands and legs, tingling, jerking, or even difficulty in hearing and talking for just 20 to 60 minutes before the typical pain headache. So this phase is known as aura. So when it comes to the headache, it can be right-sided, one-sided, or left-sided, even on the frontal or even on the back of the head. And the pain is so severe and intense, like a pulsating headache or hammering kind of headache. Even patient may present sensitive to light and sound with the sensation of nausea and vomiting. Following this, for 4 to 72 hours, that is, it can be for minimum for 4 hours, and it can stretch this headache even for 3 days. Continuing this, there is a postdromal phase, that is for 1 to 2 days, where there is decline in the typical headache pain. So to have this severe intense headache, that is migraine, there should be some triggering factors, right? So triggering factors can be even on the 3 levels like physical, mental, or even on the foods and other causes. When the person is extremely tired, exhausted, or when his body muscles, especially the upper back and neck muscles, get stiffened, and even in the low blood sugar levels, that can be the physical level for triggering factors of migraine. Even when person undergoes stress, worry, or even having anxiety issues can trigger the migraine. Even certain foods, especially the caffeinated foods mainly present in tea and coffee, chocolates, alcohol, aspartame, this is mainly found in sugar-free drinks, and MSG, monosodium glutamate, this is mainly found in Chinese foods, and even citrus fruits can be the triggering factors for migraine. So now we need to know all is about individualizing prevention and treatment options for migraine. If people are taking over the counter some allopathic medications to treat the headache multiple times a day or even on a daily basis, that can actually make the headache worse, and sometimes chances of developing a new type of headache is much higher. In the last almost decade, there's been dozens of new treatments that have come out for migraine. Some of them are not really medications at all. Sometimes even with simple vitamins and other supplements really work well to help prevent migraine or to help to reduce the severity of migraine attacks. Apart from all, homeopathic medicines have got tremendous results in controlling the severe migraine attacks, and homeopathic medicines like belladonna, bryonia, glonine, gelsemium, spigelia, sanguinaria, iris have got good capacity to control or to reduce the headache in acute attacks. If patient is suffering migraine since long term, that is if the case is chronic, then homeopathic medicines like ignitia, sepia, natromure, califos, pulsatilla, lycopodium and so on definitely helps in reducing the migraine attacks and also curing the case. Say like if you are having migraine headache particularly on the left side, then spigelia 30 can be taken. If your headache is particularly on the right side of your head, then you can take sanguinaria canadensis, or very often if you are getting headache due to the gastric origin, then homeopathic medicine iris versicolors 30 help to relieve your pain. Most of the time, migraine has been diagnosed based on the signs and symptoms presented by the patients. Further investigating it through CT, MRI of brain has proven to be not much useful. Make sure to give a try to homeopathy if you have migraine and haven't taken any form of homeopathic pills till now for migraine. Hope this video was informative in knowing homeopathy for migraine. Thank you.